Do you welcome these additional restrictions given the numbers we're seeing in your part of the world?
Well, they're necessary, so I guess we welcome them. I mean, obviously all of these are difficult, but yes, this is what needs to be happening, and we've got to make sure that we take the decisions that need to be taken, and that then as a community and a society, we are following the rules based on the best advice available. And it's really important that people do that because, we've obviously the number today is dispiriting, and to get to a point where the numbers start trending down and we can actually get through this, well, then as a community, we've just got to follow the rules and make the very difficult decisions which need to be made.
And when you say the numbers dispiriting, it is almost a roller coaster, isn't it? When you're looking at numbers day to day for Melburnians, for Victorians now, and Australians, as we see those numbers, we hope every day that they're going to be improving. Today was a shocker.
Yeah, well, it's a bit hard to tell how the rest of the country is reacting to this when you're in Victoria. But, for us, it is a roller coaster. And I was saying to a colleague today, we kind of wait every morning till about 10 o'clock to see what that number is. And whilst we all know that we shouldn't, rely on the numbers of the particular day, that you take the average over a week, it's pretty hard to actually live that. And whatever the number is on any given day seems to set the tone for the whole day. So yesterday, when there was a 2 in front of it, things seemed a bit brighter and we felt a bit more optimistic. Obviously today is in that context particularly unexpected and it's very dispiriting. But that emotional roller coaster you described that is generated by that is of itself pretty exhausting for everyone in this state, and it does in part describe why people are doing it pretty difficult, but pretty tough here.
And have you received feedback? We've certainly had correspondence. My colleague Andrew Clennell has reported repeated cases of people waiting 8, 9, 10 days for results, for mixed messages for people who get tests. That you can, one lady that's written to Richard Reardon, the member for Polwarth in the State Parliament, saying that she was told she could go out after testing being cleared after 10 days, and the Premier's been saying you've got to wait 11 days. So mixed messages happening too.
Well, obviously, we want to see the clearest messaging possible. Obviously, we want to see the quickest turnaround in the time it takes to get results once you've been tested. And clearly, all the authorities are trying to do all of that. We're also in a crisis, and things don't work perfectly in a crisis. So, we can take out cases which might be outliers and focus on them. I think we would all want to see test results come back much quicker, and it is important that we have the most consistent messaging that we can probably have. I think in that context, it's really significant that we have been speaking today about paid pandemic leave, because it matters that when you are talking from a public health point of view about encouraging people to get tested and then to self-isolate, that there aren't any consequences at work which create a disincentive from people doing that. And so I think that's a really important measure that needs to be implemented in this state and I think across the country.
When you look at the great tragedy of this last week or so, obviously the numbers are concerning, but it's the numbers in the aged care facilities and these shocking events that we've seen at St Basil's particularly, but other facilities as well, where there's been a collapse in care. It's been dire. A number of elderly left without any support for a number of days, on occasion up to 5 days, one family suggested. So this is, it's inexplicable how this could happen in Melbourne, in Australia, in the face of this crisis.
You're right, Kieran, and it certainly for those of us who have loved ones in the aged care system, this absolutely is the most terrifying aspect of the whole pandemic, and it's unquestionably what will end up being the most deadly aspect of this pandemic, and people are feeling it acutely. There are, one's heart breaks, I guess, for those families who are placed in a position where, they're not knowing about what's happening to their loved ones, and worse, they're unable to say goodbye to their loved ones at the end. I think one thing that we do need to understand here, and there's a bit of criticism flying this is an area where it is wholly the Commonwealth's responsibility. I mean, they're the regulator here, and this system had a whole lot of problems that were in existence prior to COVID coming into being. It's been chronically underfunded. There's a high degree of casualisation within the aged care workforce, and all of that is being brought into stark relief now. There are real issues around the way in which communication is happening to families, but also to the healthcare provider, the aged care providers themselves, so that important programs about people not working in more than one aged care facility, how that program is implemented is not being properly communicated to these facilities. And in this respect, I think the Commonwealth needs to take responsibility and needs to stand up. I mean, I don't actually think it helps to hear the Prime Minister talk about this as the Victorian wave and seek to, in a sense, disassociate from it. This is a moment where tough things need to be done, and tough players stand up and take responsibility and actually put in place some action. And we need to see that on the part of all our leaders, but we need to see it on the part of our Prime Minister as well, because he's got a role here.
I've spoken to a number of families whose elderly parents are in St Basil's, particularly, is the one that we've been focusing on, and they want accountability at all levels. And you can see why they're frustrated, given we had this period of really low transmission, many of us thought that we were on top of it. Sadly, a handful of cases, and we've seen it erupt. But shouldn't that calmer period have been the time that the mechanisms were put in place by both state and federal authorities to ensure the most elderly, the most vulnerable were protected?
Yeah, but absolutely, Kieran. But I think you can take it back further than that. I mean, we've got a Royal Commission into the aged care sector now because this is a sector that was failing before COVID even struck. And as I said, it was a sector that was being chronically underfunded. And actually, the seeds of what we're seeing now were sown right back then. And that is a federal responsibility. It's why we need to hear from the Prime Minister now. But, the sort of grief and the experience that is being felt by, those families who have loved ones in aged care is obviously about, the health and safety of their loved ones. It's also about when, we're going to be able to see our loved ones again. How long is this situation going to persist, and how can that be done safely? This is an absolutely tragic situation which is playing out. I can absolutely empathise with those families who have loved ones at St Basil's and across, more than 60 aged care centres in Victoria which have had a case. And we, there does need to be accountability, but it is, as you say, at every level in government, and that includes the federal government. And we want to see the Prime Minister being a Melburnian today as well. And talking about a Victorian wave doesn't give any of us a sense on this side of the border. That's how he's associating himself.
It's, when you hear families saying that they hadn't seen their mother or father for months because they wanted to protect them, they didn't want to expose them to anything, and then for them to get it anyway, it's harrowing to hear these stories. But let's just finish, if we can, on a broader question. Would you like to see a stage 4 lockdown now across Victoria just to deal with this, to get on top of it? Because right now, in the number today, it's really not inspiring any sense of confidence.
I think we need to be following the data and we need to be following the advice, and we need to be open-minded about all the options that are available. Now, one of the points in relation to a so-called stage 4, when you look at what that means in other parts of the world in terms of stopping all forms of economic activity except for essential services, were you to do that in Victoria, the problem is that it's actually in some of the essential services, like, for example, providing care and aged care facilities, that you're seeing some of the transmission occur. So it's not immediately clear that that would actually help, and it obviously would have a significant impact. I think there is a lot of evidence globally around the efficacy of wearing masks. there is a bit of a psychological hurdle that people need to jump over, but it's actually, once you've done it, it's not that hard. And if we can all be vigilant in the way in which we go about that, and so in that sense, I welcome the state government's decision to implement that mask wearing across the state from Sunday. If we can be vigilant about that, then there is hope that we can turn this number around. But we've got to do whatever it takes. Ultimately, I mean, the one point here which cannot be allowed to play out is for these numbers to continue to grow. Somehow we have to turn this around. And it's not just a matter of flattening it. We've actually got to start seeing a trend going downwards.